Hello everyone, my name is Wendy Jenkins. I had a double lung transplant about 13 and a half years ago, and it was as a result of having primary pulmonary hypertension. I'm feeling great though now, and I work from home and help run the Lungitude Foundation, and life is going well, but it wasn't always. So we're going to share some of the ups and downs of our journeys with you, and some of the things which we found really helpful to cope with mental health and different strategies which we found useful. So I'll just get everyone to introduce themselves first. Karen, would you like to get started?
Yeah, hi, I'm Karen Pritchard. I'm a single lung transplant recipient. I had my transplant about 5 years ago. It was due to idiopathic pulmonary fibrosis. I'm lucky enough to work from home and work full time, and also very well now compared to what it was like prior.
Great. And you're in Warrnambool too.
I'm in Warrnambool, sorry, yes.
Representing all the regional people.
Yes.
Yes. Great. Sam, did you want to just share your intro?
I'm Sam, I'm 41 years old, I have cystic fibrosis, and I've had 2 double lung transplants, 2009 and then 2013, and I'm a video producer by trade and working, so trying to keep busy, and yeah.
That's great. And Craig?
Hi, my name's Craig Wood. I'm 59. I had a double lung transplant 2.5 years ago. I had alpha-1 antitrypsin or COPD. Since my transplant, I'm back full-time at work, and like Wendy, I'm a board member of the Lungitude Foundation.
Great. So we're just going to go around and share more from our personal journeys of what we've gone through and some of the ups and downs, but just as a general introduction, having stress and anxiety before you have your transplant, during the transplant, after the transplant is so very normal. So if you're feeling that way, you are not alone, and we've probably all gone through periods of it or are still going through it as well. So that's one of the reasons we wanted to share this topic. There's lots of things which transplant patients need to deal with, and that can range from all sorts of things. There can be some guilt around the fact that somebody has passed and in order for you to live. There can be guilt around you not being able to do as much to help around the home. And there can be, feeling like you're a burden to others, especially if you, needing to rely on people a lot, or just even blaming yourself for your disease if that was, the situation you found yourself in. But there are some different ways that you can cope with all of this, and we do have some good resources on our website which you can access, which talk about mental health coping strategies for both patients and for carers, because the carers often get forgotten. And it's one of the things that the Lungitude Foundation are trying to do is to provide some more support for carers. And even watching this as a carer can be really helpful to get an idea of what patients go through. So Karen, did you want to start and just go through some of the ups and downs and what you found has helped you?
Yeah, sure. Thanks, Wendy. Look, I found, I think like most people, and I'm guessing here, I was quite euphoric for the first 6 to 9 months after my transplant, in terms of I could breathe, I could walk, I could do a whole lot of things. I was probably at the best weight that I'd been at for most of my life. So, everything was sort of great. And then I found that when I went back to work, and just other things in terms of family life, that there's still the same stresses and anxieties were there. And it wasn't that I expected them to go away, but I think, sometimes when I'd verbalise any concerns about any general stresses that were occurring, I was getting a lot of people saying to me, but you're alive. Mm-hmm. And I think, oh yeah. So I almost had that guilt that I couldn't verbalise to friends and to family that, this is really bothering me at work, or we're under a bit of financial stress because Pat had, time off work. And if I did, people said, oh, but you're okay now, you're alive. And it was like that was the panacea to everything, the answer to everything. And the reality was I was still suffering the same stresses that everybody else goes through in their life, but feeling in a way that I didn't have the right to. So I actually got myself into quite a state of being quite depressed. And I really withdrew into myself and lost a lot of my confidence. So I actually reached out to a number of people, and I know Wendy sent me a tremendous book. I was telling Wendy how sort of flat I was feeling. I spoke to my GP, who I have a really great relationship with. I sought some counselling, ended up with a psychologist that she said, I feel like I shouldn't charge you because we'd laugh so much during our sessions that I entertained her. But, like what I did was I did reach out and talk through these things. And I think that's really, really important. And I think as, and I sort of was able to sort of forgive myself and say, you can still, life happens. And with that, when you're a parent, when you're a partner, when you're a worker and a colleague, all of these same stresses are going to happen that happened before, and you are entitled to have a grumble about that and to feel those things and to need to work through that. So, that was sort of early on. Probably it lasted, it's hard to say whether it was 6 to 8 months. It could have been a bit longer, but I really needed to work through that and sort of say it was okay. A little bit of survivor guilt in there as well. And a little bit interesting because I have a left lung buddy, I've got a right lung. And so, working through that and how each of us were travelling through our recovery, because it was sort of a bit different at times. And then it was about not comparing. So I really learned, don't compare because there's probably no value in that.
Yeah.
So that's some of my journey.
Yeah, no, that's great. Thank you for sharing that. And that is so important because everyone is so different. All the patients I've met over the years, the journeys are just so different. I'm yet to find anyone who's the same. So, you do you, whatever your experience is, that is what it's going to be. So Sam, how about you? How have you found it?
Well, I have found that it has been quite different. I always used to look at people that were always at the Alfred Hospital being sick, and that's all I knew, and people passing away and everything. It's just, and I was I needed a transplant, and the doctors kept telling me, and I waited like literally 5 years until I understood and had the confidence just to sign up and then finally make the decision.
Yeah.
And I even travelled and did a Kentucky tour. I said, when I get back, maybe I'll sign up. And I was quite unwell and needed oxygen on the plane and everything.
Yeah.
But was just trying to set goals and still going to work until my boss said, you can't do camera work anymore, carrying all these tripods and all that. It was a lot of exercise. I was always out of breath, so then I just became an editor. So I did adjust my life in a big way like that. It's just, I got to the point where they put me aside saying you need to sign up and have a transplant. And I don't regret, because I did live an extra 5 years and I was like under 22% until I got to that point where I did. And I waited 7 weeks and I was still going to work and I was fine for about 2 or 3 years. To keep my mind off things, I was always mentally not well and pretty stressed out. I was always postponing to build 2 townhouses with my brother that also has the same condition as me, and he's quite well. He doesn't need a transplant yet. And I was, never forget this, because I was showing doctors and nurses architectural plans while I was admitted to hospital. So that was my goal, to keep my mind off things like, I'm going to live. I will sign up for a transplant, and I did. And I waited 7 weeks. Then I got to about 95%. And then I just started dropping. I had a trip booked to Mauritius to film a wedding, and everything dropped, and I had to have another transplant, and I was building 2 houses at the same time. And I was showing doctors and surgeons, and said, while I was on the list, I said, if you do a good job, maybe I can move in. And it happened. The frame was up, and I waited 10 months for the second transplant, and it was all well. And there's the set that I've got still now.
Yeah.
And I was on hospital in the home, unfortunately, after that for 2.5 years for serious infections and skin cancers. And hospital in the home helped me move to my house, and I set up one of the wardrobes for the nurse. Don't forget the IV, drip pole, everything. It's still set up, and it was an amazing experience. And it's important to keep something, have a goal to achieve. And other people still can't believe it. That I was still going to work. I was building 2 townhouses. What was next? I said, well, I booked it in. I ended up going to Mauritius. I went to the transplant games in the Gold Coast.
Mm-hmm.
The doctors go, what's next? I said, the World Transplant Games in Newcastle in London. And that was just last year.
Yeah.
And I went to Italy and Germany and visited family and friends, and it was amazing.
Yeah, I think that's really important, Sam, having goals like that, because it's too easy to get caught up in the day-to-day of what you're doing to survive, but you want to thrive. So you actually want to still be doing other things which are going to give you purpose and passion, and make you feel like you're getting fulfilling the life, because you've got this extra chance, so make the most of it. So that's great. What about you, Craig? What's your story been like?
Probably twofold for me. I was diagnosed 16 years before my transplant that I had COPD, and I had 36% lung capacity, and from then it just dropped and dropped. And I withheld it. I didn't tell anybody. Only my immediate family knew the issue I had. So I was still going to work. I was going to state trips, and when we're walking up hills, I'd pretend to be limping with a sore knee or get on the phone. And so I had sort of that, I suppose, anxiety and mental issues there, not wanting to tell anybody about it. And then when it came to the time to have the transplant, luckily I waited 6 days and got it after I signed up typically. And from then on, obviously my life changed dramatically, where I'm doing things like Karen said, I'm walking, I'm doing things I've never done before. I've put on weight. Obviously one of the big concerns is putting on weight. I've put on 8 kilos since the operation, which is typically, all around here. And as much as I walk and keep, I can never get rid of it, but we all know it's the steroids and the meds you take to do that. So probably the thing for me was coming out of it and seeing what my family had done for me over those years, what sacrifices they had made, where we were, what we do as a family. We do everything to suit Craig all the time. On the flip side, what my wife did for me as my carer in that time from the transplant to 3 or 4 months later, when I could finally stand on my own 2 feet and start going to work, etc. From then on, it's been sort of rolling on then. With COVID doesn't help now. I've been working from home for the last 4 months. I'm not getting out of the place. It's like Groundhog Day every day. So luckily we've got a support network within my team that I work with, my managing director, and also the people around me. So obviously my wife is my carer. My kids are all adults now, so it's great to have them pop in and talk to you. And so they uplift you when you get down, and you don't mean to get down, you don't think you're getting down, but you get in that rut, and you've got to get out of it. I've got a great doctor locally who I see every 3 to 4 months, and he's just like that puts a smile on your face no matter what's happening. It's always about, don't forget that person, you're not as bad as that person. And as Karen said, we're alive. We're doing things now that we haven't done because of a double transplant or single transplant for many, many years. So I've always got to look on the positives when the negatives start to come in, and that's the way I sort of cope at the moment. But life's wonderful. As I said, we're all alive. We're doing things we've never done before. And I think the family and the care aspect is the big upshot for mental health. If you've got your backing of and especially with me with adult children as well, they're always good to talk to. They understand, they know where you've been and what you've done, and they help you have that transformation as well.
Yeah, there's some really valid points there, and having that support is key. One of the things I've ended up doing is becoming a resilience coach off the back of just some of the experiences I've been through, and that is such a key thing to have, is support around you. So my journey has a few overlaps with some of you, but again, it's a different story. I was a bit surprised to get diagnosed that I needed a lung transplant, and was just losing energy, having trouble walking to the post box at the end of the driveway, and short story later, I ended up being told I had 2 years to live unless I had a lung transplant, and that was the start of the emotional roller coaster for me. And I guess I'd always been the sort of person that had planned out life a bit, which is probably not in hindsight a wise thing to do, but I had these goals of what we were going to do, and that all got put on hold. In fact, a lot of it got cancelled. We were going to go travelling overseas on an expat assignment. We obviously wanted to have a family, but we weren't able to do that. So there were lots of things that initially I found really tough, and I was probably good at hiding it from a lot of people, so no one knew that I had severe depression. So some tough times there for a while, and I ended up seeing a counsellor for 6 years every 3 weeks. So I really thought I needed professional help because whilst I had some very well-meaning family and friends, they weren't trained in, how to say things. And it's like Karen was saying, I had a lot of instances the same where people would kind of go, isn't it great you're alive? You must be so happy. And, they just assumed that I was on this high all the time, the high of life. But in actual fact, I was still going through major depression and a form of PTSD, and I couldn't have children. My husband couldn't either. There was a lot of guilt around not being able to have children for him because he always wanted half a soccer team. So, not that was going to ever happen, but all of those dreams for him too. So I felt a lot of guilt there. I had to step back from the workforce, so a lot of that fell on him. So for many years I felt very guilty, and there was this thing again, like Karen was saying, that I shouldn't say any of that because people think I was ungrateful and that I didn't appreciate getting the new lungs, when in actual fact I did. But post-transplant can be just, there can be some tricky times as well, and a lot of people don't see that side. So something my counsellor said to me, which I always remember, she said, keep the happy times for your family and friends and those around you. Tell me all the dark times. And so that is how I coped. I had somebody professional to deal with all of that. And then, not that I put on a brave face, but I just didn't need to share a lot of that with other people, and I just focused on the fun stuff with them. And for me, that worked really well. And then I got to the point one day where I just had that light bulb moment and went, you know what, enough's enough. Stop being a victim and, thinking sad thoughts about all of this. You're past the average life expectancy, so just get on with things. And since then, I can say I've almost done a 180-degree turnaround, and now it's just full of positives and, looking at all the things which I have been able to do and things which I would never have done before. So, for example, never would have set up a charity, never would have probably had my own business, or at least this age. There's a bunch of things which I've pushed myself to do because it's one of those things that you go, well, I don't know how much time I have, so this is a good push. And now I'm looking at, long term. Well, I know people who are up to 30 years, so I throw the 7-year average out the window, and I tell patients that all the time. Don't think about the 7 years, think about, what could be. So I think that's a good way to approach life too. But yeah, it is ups and downs. Like everyone here has shared, you do have good days, bad days, and that is fine. And just pick and choose who you tell things to, who you're going to get your support from. So maybe just another quick around the group. Is there anything else anyone would like to add about coping strategies, mental health, anything like that?
I think for me, some of the points you raised, I had that automatic of, I've got 5 years and I have to do all of this in 5 years. So I don't know why, I just felt like I had to get everything sorted for my 3 boys and my husband and get it all planned and get it done. And so I went on this really manic, I've got to get everything done and everything organised. So I had this fixation of that's all I've got. So when people would talk about things in the future, and if I ever said anything, I said, oh, look, I might not, I won't have the opportunity to do that. And people would say things like, oh, we can all get hit by a bus. And in my head, all I could hear was, yeah, but you also have a good chance to live to 80. And I probably don't have that. But I think that was that, but I had to move away from that. I had to move away from that expectation of what I've got, or putting that limit on myself, or also, in a way, being angry at people for not understanding, because of course they couldn't. It was, so instead of it being a blaming thing, I just went, they just can't. So I think I wanted to explain to people all the time, and then sometimes you feel a little bit self-indulgent with that. So it just was a case of accepting that some people will get it and some people won't. And you're right, pick the things you want to say to those people that will have a little bit more understanding about that. So, it's that sort of helped me, and not being in such a panic stage that I'm the only person that can do things moving forward for the family or for others. They can do things for themselves. So not to be an enabler, but to be an empowerer. So I think there's been some big changes, but it fluctuates. It's a really good period of time for me now, but it may not be at some other time. So I think you've just got to keep working on it. Like you work on your physical strength, you've got to keep working on your mental strength as well.
Yeah, no, that's very true. And what about you, Sam? Anything else you'd like to add?
Yeah, I think it's quite important to actually not just show patients that are actually in hospital. Every time I just used to picture, oh, so-and-so passed away, or someone's back in hospital sick. But what about the people that are travelling around the world, running their own business, and they're not spending any time at the Alpha?
Yep.
That made a huge difference to me. And I kept thinking, oh yeah, the 7 year, that was my anniversary just this year, 7 years. But I've got to get that out of my head, because I know people that have had it over 20 years. My day is never up. So I think that's to keep positive in life and seeing other people, what they're doing, and with success. Not everyone is the same, which I think is quite important.
Yeah, and that's a very good point. I think it's one of those things, isn't it? When you go into hospital, all you're seeing are the sick people. You're not seeing all the ones that are healthy and working and getting on with life. Like I only go in every 3 months. I literally go in to get my scripts done, to have a bit of a checkup, to do my lung function test. And I remember I went in a few months ago, and one of the new nurses mistook me for a carer because she said, "Oh, I didn't even think you were a patient." So you may be seeing people who are actually patients and they're not. And you don't think they are. So yeah, that is a good point, Sam. And what about you, Craig? Just to finish us off, anything else you'd like to add?
Oh, look, as Karen and Sam and you both said, it's a wonderful thing we've had done. Obviously, I look for the success of myself and the health I've done. I want to portray that to other people, let people know how good it is, how wonderful it is to have a second life. Obviously, like you, Wendy, I'm on the Lungitude Foundation now, so I want to show people, bring back to people and do this, explain to people how good it is, how we can help people. Because a lot of people, like when I first had it, I knew nothing about a transplant. I was lucky enough to meet a gentleman who had a transplant. He and his wife, my wife and I, exactly what we needed to do, what we look forward to, the goods and the bads. And I want to do that to other people as well, because there are a lot of bads, but there's a lot of goods in it as well. And I mean, the goods are what we like to portray to people. So that's what I like to say.
Yeah. I think that's a great note to end on. And thank you everyone for sharing that. Like I said before, we have some resources on our website. Reach out if you need help. You can go via your GP as a starting point. You can reach out to the staff at the hospital or clinic that you're at. You can talk to good friends that have got a good ear for this sort of thing. But yeah, there's plenty of support out there. There's lots of websites like Beyond Blue, etc., that you can look at as a starting place. But yeah, I think that's a good summary of at least our stories, and we'll try and share some more stories over the next few months as well, so you can see what everyone gets up to. So thank you everyone, and we'll see you another time.
Thank you.
Thank you. Bye-bye.
Thanks,
Bye.
Bye.